Hello, everyone. Welcome to another episode of Darshan Talks. I have a really special guest for everyone. I have Dr. Catina O'Leary.
This is the Darshan Talks podcast, regulatory guy, irregular podcast with host Darshan Kulkarni. You can find the show on Twitter at Darshan Talks or the show's website at darshantalks.com.
Catina, I'm going to give you the podium to talk about yourself and about HLM, and we'll kind of go from there a little bit.
Sure. Well, thanks for having me. I'm really excited to be part of this conversation. I really love every opportunity to talk about health literacy, and very specifically how health literacy can help people think about doing their best work in clinical trials and clinical research. But I work for a company, I lead a company called Health Literacy Media. We're a small health communications nonprofit, and we're based in St. Louis, Missouri. We're only about 10 years old. We were created with support from a large health foundation here in Missouri. And our whole goal was to improve health literacy in Missouri. So that's what we set out doing. But what we found over the decade or so that we've been in business is that, these boundaries of Missouri aren't real. They're sort of arbitrary. And so we've expanded our work, and we started to work outside Missouri pretty quickly. And now we work all over the world. And so in the beginning, we were Health Literacy Missouri, but now we're Health Literacy Media. And despite all that, our focus really hasn't shifted much. So we do health literacy work all over the place, and we're excited to talk about it.
But Catina, I mean, that's absolutely, a wonderful background for HLM, but you are yourself unique, and you actually bring in a really interesting perspective to HLM. So why was this the right fit for you?
Sure. Thanks for asking. I'm a social worker by training. I spent about 12 years at Washington University at the School of Medicine here in St. Louis before I got to Health Literacy Media. And my work there at Washington University was focused on behavioral research in areas of drug abuse and dependence, and also HIV prevention with pretty complex community recruited individuals. And so the work that I was doing most of the time I was there was working with women who had challenges with alcohol and drugs, and those challenges led to their risk for HIV and other sexually transmitted infections. And we were really interested in figuring out what kinds of behavioral interventions could help people change their lives in ways that were healthy and more productive for them. And so we had pretty involved behavioral intervention trials over a period of years, mostly with women. And the reason for that was because the trials before had included men and women. And what we found is that people in trials when there were both genders, the women had a little bit more challenge talking about the differences in their issues when men were also involved in the interventions. And that was because the drug abuse and sex behaviors that were connected were so complex that the women's issues were just very different. So we spent a lot of time working very specifically with women, and I worked with women in criminal justice systems and women in vulnerable communities in St. Louis, but then all over the world. So we had the same kinds of trials in India. We didn't do HIV prevention at that time, but we did some trials with people who had drug-related issues in Thailand and Taiwan, and we were working with kids who were taking party drugs in Taiwan. So really sort of figuring out in the most complicated environments how to get people to engage around their health and think about how to change their lives in ways that were more healthy and focused and productive. So I did that work for a long time, and it's very different in some ways than health communications. But at the core, it's the same kind of thing. You have to engage people where they are and help them think about the issues that matter to them and ways for them to understand their health and their lifestyle and make choices actively about the kinds of lives they want to live. And health literacy sort of aligns really well with that. So about 7.5 years ago, I came to HLM, and I've been here since.
Sounds like a perfect story. Let me ask you I have several questions that you've already started off with, and I have to apologize, Catina. We started off with having a general idea of which direction we're going to go, but just your background lends to so many interesting questions to me. So please feel free to redirect me if you think we're sort of going on a path that is less interesting. You know the answer to that question better than I would. But when people talk about health literacy, that means a lot of different things to a lot of different people. What in your opinion, based on your significant experience here, the difference between health literacy and health education? Or is there a difference at all?
Well, I think that health education Actually, we talk about this a lot in our group because there's a lot of overlap with many different fields. Health education and health literacy is one. Plain language and health literacy is another. We think about sort of marketing, communications, health communications. All of those things have shared components and characteristics. But I like to think about health literacy as being more of an umbrella area, and it includes components of those things. So if you're doing good health literacy work, you certainly are thinking about health education. And you're certainly paying attention to strategies of plain language. They're part of what you need to do to incorporate clear communication that's understandable. And you certainly want to think about sort of marketing and advertising and how do you grab people's attention and hold it. But if you pull yourself up to a higher level, when you're thinking about health literacy, one of the key factors is that you're thinking about the people that you're trying to engage across levels and what they need to know and what they want to know, and how they can use that information to make good decisions. So it's not just about the education, it's not just about the information, it's about what they do with it and how they engage with it and how it makes a difference in their life. Does that make sense?
Sort of, but I guess I'm confused. You said one basic thing there, which really to me changes the conversation. It's not just what you give to them, it's what they do with it. What are some things they can do with it? Because it's right now, healthcare, as you know, is a very passive process in that the physician tells you what to do, the pharmaceutical company tells the physician what they know, and the patient's just expected to follow along. How does health literacy change that ballgame, if you will?
Well, I think it changes it in a lot of ways. So I think that's very much the sort of setup, is that the doctor or the company tells you what to do and you follow along. But when you're health literate, you start to learn that that's not actually the only path, and that's not the requirement. I taught a class last night. I gave a lecture to a class at Washington University last night, and I talked about this with the students. So with all my education and experience and everything I do in health literacy, I'm still learning too. So because of my age and stage, it was the appropriate time for me to get a mammogram this year, and I went to do that like I'm supposed to do. And I got a letter in the mail that told me that, okay, you need a diagnostic mammogram now. So I went for the next level of care, and I did what they told me to do because they told me to do it, and I got the letter. And then I got another letter that said, oh, well, there's still some issues. We don't see what we need to see. We're going to do a biopsy now. And so I went and I did that next thing, and they did the biopsy and went through the whole shenanigan and told me that everything's fine and there's no problem. And I got a bill in the mail for $2,500. And along the way, one of the things I learned is that, in fact, they didn't actually see anything that was that problematic, but there's some algorithm that gives them a certain percentage of people that they send these letters to in the first place. And I didn't know that. And so I did the thing they told me to do. I didn't ask any questions. I didn't call my doctor to say, geez, I got this letter. What did you see? What does that mean? What's the chance that this is really cancer right now? Do I actually need to worry about this right now? Or is it okay to wait a minute? I didn't ask any of those questions because I got the letter in the mail and I felt like I needed to do what I was told. And I'm not saying that people shouldn't do what they're told when they get the letters. But I think that once you get really involved in the system, you understand that there are questions that you can ask, and those are fair questions. And it's okay to call back and say, what does this really mean? Can you tell me more about this? And what do you see? And if I had asked those questions and the person had said, oh, we see a little bit of cloudiness here, it usually doesn't mean anything, but, the system triggered that you might want to come back in. It's not urgent that you miss your vacation. In fact, they did call me on the phone while I was out of the country and sort of alerted me to the point that I felt like I needed to think about whether I should come back early and all of these things, to only later find out that it was, more of an algorithm than a real problem. And again, I don't want people to not think about or not pay attention to these important alerts, but I do want people to think about the opportunity to ask questions and engage. You're allowed to do that.
This is a great example, and I want to delve into this. Obviously, we've run out of time on this podcast, but stay tuned. What Catina, I think you may have even said without saying it, is there is an inherent lack of transparency in the system, and part of it has to do with a lack of access to healthcare practitioners. And health literacy and health literacy media are together hoping to solve a part of that problem. So stay tuned. We're going to discuss that a little bit more in the next podcast. Thank you again for being with us, Catina. This was amazing. Thank you so much. Stay tuned, everyone.
This is the Darshan Talks podcast, regulatory guy, irregular podcast with host Darshan Kulkarni. You can find the show on Twitter at Darshan Talks or the show's website at darshantalks.com.